Hi everyone, this is Dr. Rajini, Gynecologist, Laparoscopic Surgeon from Care Hospital, Banjara Hills. Today we are going to talk about hypertension in pregnancy. We know what is hypertension, where our blood pressures are higher than normal range. Pregnant ladies too can get high blood pressures during their pregnancy. Some of the pregnant ladies, they could be already a chronic hypertensive, and when they get pregnant, so that also is a risk factor, can shoot their BP levels into higher levels. So when do we call this woman having hypertension during pregnancies? When the systolic blood pressure is more than 140 and your diastole is more than 90 millimeters of mercury after 20 weeks of pregnancy. And there are different types of classifications of hypertension in pregnancy, like gestational hypertension, preeclampsia, chronic hypertension imposed on already chronic eclampsia, and gestational hypertension. So in this pregnancy, what is the necessary treatment that has to be given? So whenever a patient comes to us for regular antenatal visits, we do check their regular weight gain and blood pressure in each and every visit. Whenever we see like there is some increase in blood pressure, so some of them will need the lifestyle modifications, and few of the ladies need some antihypertensive, and such patients are the patients coming to high risk group where they have to be closely monitored, and few necessary extra investigations which are to be done in such patients. So what are the complications? Talking about the complications of this hypertension in pregnancy, whenever a woman is hypertensive, if the blood pressure is not under control, she can land into eclampsia, that is an emergency, where the patient blood pressure is shooted up and she may land into fits, throwing convulsions. So it is an emergency. Immediately she has to consult the doctor and take all necessary investigations and management. Sometimes the placenta may separate from the uterus even without having labor pains, called as abruptio placenta. This is also one of the complications of hypertension in pregnancy. Talking about the baby, when the mother is hypertensive, the blood circulation which has to be passed from mother to fetus, it will little bit compromised and may lead to IUGR, that is intrauterine growth retardation. The baby may not grow up to the level of a normal pregnancy. The baby's weight will be less than the other normal pregnant ladies. So whenever you're diagnosed with hypertension in pregnancy, you should be under very close monitoring. Get a regular daily BP checkup done at home, and keep updating your doctor your blood pressure levels, and take all the necessary antihypertensive, whatever medications they advise you, dietary modifications, and then it will lead to a successful outcome and a healthy child. Thank you.